If your doctor has recommended a hysterectomy to treat your condition, you may have several questions. To better understand this process, it is important to know what to expect before, during, and after. The female reproductive system consists of 2 ovaries, 2 fallopian tubes, uterus, cervix, and the vagina.
The definition of a hysterectomy is the removal of a woman's womb or uterus.
The most common reasons for a hysterectomy are heavy vaginal bleeding due to tumors of the womb, either malignant or benign, persistent pelvic pain that continues after trying various medical procedures. It is an emergency caused by an obstetrical problem, and the only way to stop this vaginal bleeding is through a hysterectomy. Cancer. Cancer has been diagnosed and you are referred to get a hysterectomy. Days before the surgery. You need to bring the medical order to admission. Solve the payment process and ensure you have the laboratories required. You will usually be asked not to drink or eat anything for 8 hours before the surgery. On the day of your surgery, take a shower with the antibacterial soap prior to the surgery. The area of surgery cannot be shaved 72 hours before surgery to avoid risk of infection. Take any medicine your doctor indicated with a small sip of water. Do not bring valuables or jewelry. Doctors Hospital Renaissance will not be responsible for your loss. Do not wear makeup or nail polish on the day of surgery. Normal skin color and circulation is difficult to determine under makeup and polish. Arrive at least 2 hours early of the time of your procedure. Go to the main entrance of outpatient, located between Dub Avenue and McCall Road. On arrival at the hospital, turn to your designated parking area. First, you will enter to a waiting area called pre-op to get your medical history. Fill the required consents, and you will be provided with some of the medication needed for your procedure. The waiting time will be approximately 1 to 3 hours. Then you will be redirected to the surgery room, or also known as OR. You will be given anesthesia, pressure socks to prevent any formation of blood clot, and any other medication as necessary. After the procedure. At the end of your procedure, you will be transferred to a recovery area. This area is not allowed visits. Only a family member previously assigned by you could talk to your doctor to learn the results of the procedure. After surgery, you will be given pain medicine. You may also have a tube called a catheter inserted into your bladder to pass urine. You will be asked to get up and move around as soon as possible after surgery. This helps prevent blood clots from forming in your legs and speeds recovery. You will be asked to get up to use the bathroom as soon as you are able. You may return to a normal diet as soon as you can. How long you stay in the hospital depends on the type of hysterectomy. You can likely go home after 1 to 2 days when surgery is done through the vagina using a laparoscope or after robotic surgery. When a larger surgical cut in the abdomen is made, you may need to stay in the hospital from 2 to 3 days. You may need to stay longer if the hysterectomy is done because of cancer. Under no circumstance are you to drive a vehicle for a 24-hour period following your surgery. It usually takes from 2 to 6 weeks to recover fully. You may get tired easily during this time. At home, try eating smaller meals with plenty of fruits and vegetables, and drink at least 8 cups of water a day to keep from getting constipated. If stitches, staples, or glue were used to close your skin, you may remove your wound bandage and take a shower the day after surgery. If tape strips were used to close your skin, cover the wounds with plastic rag before showering for the first week. Do not try to wash the tape strips off. They should fall off in their own in about a week. If they're still in place after 10 days, remove them unless your doctor tells you not to. Do not go swimming or soak in a bathtub or a jacuzzi until your doctor tells you it's okay. Start walking after surgery. Begin your everyday activity as soon as you feel up to it. Do not jog, do sit-ups, or play sports until you have checked with your doctor. Ask your doctor about driving. You may be able to drive after 2 or 3 days if you're not taking narcotic or pain drugs. You may lift 10 pounds or less. Do not do any heavy lifting or straining for the first 3 weeks. You may be able to go back to a desk job within a couple of weeks. Do not put anything into your vagina for the first 8 to 12 weeks. This includes douching and tampons. Do not have any sexual intercourse for at least 12 weeks, and only after the doctor says it's okay. Resuming intercourse sooner than that could lead to complications.
When to call your doctor after surgery. If you have a temperature greater or equal to 100.4 degrees Fahrenheit, if you have persistent pain even though you're taking your medications correctly, persistent nausea and vomiting, and discharge or bleeding from the wound. And if the patient or her family members have any concerns on any symptoms, please contact your doctor immediately.
Doctors Hospital Renaissance hopes this information was beneficial for you to have a prompt and safe recovery. For more information, please call 362-2015.
DHR Health Network.